Hello, my name is Nanette Friedman, and I'm with the Alzheimer's Association. And I'm here today to talk to you about the warning signs of Alzheimer's and other forms of dementia. But first, let's look at our vision: a world without Alzheimer's disease and all other dementia. The Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. The Alzheimer's Association is here all day, every day for people facing Alzheimer's disease through our free 24/7 helpline at 1-800-272-3900 and our website at alz.org. Take the challenge out of finding dementia care resources. Use our community resource finder at alz.org/CRF. And COVID-19, Alzheimer's and dementia, what you need to know, is also available at your fingertips. Locally, we offer programs and services for our families facing this journey. Support groups offer support for caregivers of persons on this journey. Education workshops, such as the 10 warning signs, understanding Alzheimer's disease, effective communication strategies, understanding and responding to dementia-related behavior, dementia conversations, and healthy living for your brain and body are available at no charge for families, persons living with the disease, and those they love. Conferences are available. Social activities are planned. We offer early stage engagement activities for the care partner, caregiver, and the person in the early stage to enjoy together. Care consultations offer the opportunity for a conversation with the family, the care partner, and the person living with the disease. And as always, 24/7 support. Again, always take the challenge out of finding dementia care resources. Use our community resource finder by going to alz.org/CRF. And now we are looking at our purple dementia umbrella. Dementia is the umbrella term for a person's decline in memory and other cognitive abilities that is severe enough to interfere with daily life. It is not a normal part of aging. The most common cause of dementia is Alzheimer's disease, a progressive brain disease that results in the loss of brain cells and function. We also see Lewy body dementia, vascular dementia, frontotemporal dementia, Parkinson's disease dementia, and Huntington's dementia. And some individuals may be diagnosed with mixed dementia. Now let's look at the 10 warning signs. We see memory loss that disrupts daily life. That loss of short-term memory can include the loss of recent conversations. What did I have for breakfast or lunch? It can also affect driving and bill paying. Number 2, challenges in planning or solving problems. Thinking through a thought, organizing, planning are all affected by the decline. And people with dementia will need more support to help them navigate their day. Number 3 is difficulty completing familiar tasks. And every single task that we engage in from morning until night is full of complex steps that we must master every day. And as this disease goes forward, the care partner, caregiver must step in and support the person with the disease. Confusion with time or place. Many persons with dementia are very confused if something is not happening in the moment. tremendous confusion. Number 5 is trouble understanding visual images and spatial relationships. And again, these losses can affect our ability to drive, our ability to discern what we are looking at, and affect problems with balance. New problems with words in speaking or writing. As we lose ability to remember information, we also may come across individuals that are having difficulty with language. And as we lose the ability to share our thoughts through language, we also lose the ability to read and to write. Number 7 is misplacing things and losing the ability to retrace our steps. We all have those important hiding places for those important items. Unfortunately, on this journey, we may need help finding those important items in those important places. Number 8 is decreased or poor judgment. As this disease unfolds, safety becomes paramount, and we may lose our ability to keep ourselves safe. So we rely on those around us who care about us to maintain safety. Number 9 is withdrawal from work or social activities. As people with dementia lose cognition and lose function, everyone needs assistance to enjoy all those hobbies and activities that were once loved. And 10 is changes in mood or personality. And many families see tremendous change and rely on supports to move forward. So as we continue to think about Alzheimer's disease and other dementia, we are always looking for volunteers who can support our activities and help our loved ones move forward. Feel free to go to volunteer.als.org for more information. And we also are always very interested in what happens as we age gracefully. And we sometimes may walk in a room, not remember why we walked into that room, or we may forget to pay a bill. We may forget to change the oil in our car. So sometimes we do forget common information, but we're able to retrace our steps. And that's the difference between the aging gracefully, as I mentioned, and the decline of dementia. But it's always important to check in with your physician, check in with your medical provider. If you have any questions or you have any concerns, talk to your doc. And last but not least, we are gearing up for WALK. And in Rochester, we have 3 walks on the horizon, starting with the walk at the very end of September in Canandaigua. On the 30th, the walk in Rochester on the 7th, and the next Saturday is the Watkins Glen Walk. And we hope to see you at WALK. And as you know, WALK happens in over 600 communities across the United States. And WALK enables us to fund research, fund care and support, and keep our families thriving. And thank you so much for your time today. I appreciate your attention. We are always looking for your support, whether you will walk with us or volunteer with us. And if your family has questions, please reach out to us. You are not alone. We are here for you.